Hello, welcome to HLA Live. HLA Live is our regular broadcast on the HLA YouTube channel as well as all the other social media channels. Each week we talk to interesting people from across the HLA community.
Good evening, everyone. I am really excited to be chairing tonight's meeting.
Hi, I'm Rosie Spooner and I'm hosting HLA Live this Wednesday.
And I'm an HLA scholar and I'm also going to be your host this evening.
To share with us their ideas and their innovations and hopefully bring them to a global audience.
Quite quick, we have ideas, let's do this, let's do that. So
many of the topics come from our community, with scholars and faculty expressing an interest in many of the discussions that we're about to have.
Hello everyone and welcome to the HLA Live session on widening participation in the postgraduate realm.
Homelessness and health.
Addiction and the new normal.
HLA programs are built on 6 pillars. The leader is an innovator and entrepreneur. The leader is a communicator. The leader is a manager. The leader as a negotiator. The leader is a follower, and the leader is a philosopher. If you are interested in becoming a HLA scholar, why not get in contact? Many of the episodes in HLA Live will cover one or more of these important pillars. The HLA team consists of Pedra, Eamon, Tim, Riddy, Alistair, Adil and Trisha, and a range of other HLA scholars and faculty.
Episode 46 of HLA Live is Self-Care, System or Self, hosted by Ilaf.
Welcome everyone. Thank you for joining us on this episode of HLA Live. My name is Ilaf Maslawi. I'm a fourth year medical student at the University of Southampton and a current HLA scholar. I'm working on introducing Medics for Medics at Southampton, a peer support initiative acting as an early intervention program for medical students and by medical students. And that's something that is going to be introduced very soon at the university. I'm excited to be chairing tonight's panel as we'll be discussing such a vital topic, self-care. As healthcare professionals and students, we have chosen to help others, oftentimes at the expense of our own mental and emotional well-being. Now, of course, the pandemic itself exacerbated the pressures of the job, and we are still dealing with all of those. But issues have existed before the pandemic, and these issues will also continue after it too. As healthcare professionals, we are trained to care for others, but not to take care of ourselves. Now, can we balance our personal care with our professional responsibilities? How do we go about living a healthy life whilst also providing good care for our patients? And does the system care about its healthcare professionals? We'll be discussing these questions and talking about what self-care is, what burnout looks like, and what compassion fatigue feels like. I'm joined by 3 amazing speakers who have all been on the front lines and who all have a special interest in well-being. I will let them introduce themselves.
My name is Dr. Mar Khwaja. I am a dentist, having graduated 11 years ago. I also founded a wellbeing company 2 years ago, Mind Ninja, and I am really passionate around psychological resilience and wellbeing for dental and healthcare professionals. I'm actually also a positive psychologist, so I completed my master's in applied positive psychology. I'm particularly interested in evidence-based preventative wellbeing education.
Hi, Laf. Thank you for inviting me to present tonight with this amazing panel. I am Sudhir Daya. My pronouns are he, him. I'm a gay, cisgendered, able-bodied, middle-class male of South Asian heritage who grew up and studied in apartheid South Africa before coming over to the UK. I work in the private sector and run a clinic, Integrated Health, which brings together and offers physical and mental health services. And this whole person approach to care led me to form The Life Architect, a human potential consultancy empowering people to design and construct the life they want to live. I currently have a focus on equality, diversity, inclusivity, and belonging, and I'm convener of LGBTQI+ network and the BAME network.
Hello, thank you for having me on this panel. I feel like everyone else is very experienced. I am an F1 junior doctor in Glasgow at the Queen Elizabeth, and also I want to set up a spin company for the NHS that focuses on well-being. So it's kind of using exercise as well as kind of positive motivation at the same time to make people feel like they can achieve what they want to achieve in life.
Thank you, everyone. Thank you for joining us today. So to start off today's conversation, I really want to get a grasp of what burnout is, because the word is thrown around quite a lot, and although it tends to be something that has negative connotations, and it's still a word that's kind of frowned upon because of its aspect with mental health and mental well-being, and there's still stigma within the medical community about kind of mental strength, and if you're burnt out, all of a sudden everything about you is put into question and your ability to practice is put into question.
So I can chip in here. So I've, my 11-year career in NHS dentistry, I've experienced burnout several times, and actually it kind of led me to founding My Ninja. So I experienced this, and when I looked at the research, I just couldn't see anything at crisis point. There was only things at crisis point, but nothing really preventative for us. And when we look at the research, we know that this is preventable. So I guess the first point to make is that it's an occupational hazard. Working as a healthcare professional, there's certain risks, and burnout is one of them, and compassion fatigue is another. We also know that, it's common in other professions as well, but specifically in healthcare, within dentistry and the community I work in, it's high. So in the UK, it's 8 to 30%. With burnout, if we look at, I guess, how psychologists define it, so what we would say is that there's 3 components to it. So you have emotional exhaustion. So this is when we're really emotionally, knackered. We can't just fix this with going on holiday. There's another component which is really quite scary. It's classified or called depersonalization. And what that means is we lose our sense of empathy and connection with our patients, and we almost see them as objects. I'm sure all of us have experienced elements of this. So this isn't, something that only certain people might be prone to. The third aspect of burnout is this lack of personal accomplishment. So we feel very much like we're not really making a difference. No matter what we're doing in that profession, we're not really helping our patients, and we feel this tremendous kind of disconnection. A big part of burnout is the impact it has on our thoughts, our feelings, and our actions. So we know with burnout, you have this tremendous kind of negative thoughts towards work. You might feel, the common kind of negative thought is, I'm not good enough, I shouldn't be in this position. And it does mean often that we might, miss work, we might go into work, but we're not actually there. We're much more prone to kind of mistakes. It is something that can impact all of us. I think from my standpoint, upskilling to become a positive psychologist and looking at this research, this is preventable. This is an occupational hazard. We all go potentially through symptoms of this. We know that psychological tools can really buffer us against this. So, it seems madness not to focus on clinician wellbeing at undergraduate level, postgraduate, beyond a single webinar, really talking about courses, so we can learn these tools really early on. And then the only other thing I wanted to mention is that burnout can lead to compassion fatigue, which is something that's similar to burnout, but another kind of additional factor is with compassion fatigue, you take on the suffering of your patients. So for example, as a dentist, I'm treating patients over many, many years. I've been at my practice. I see patients that have, gone through all sorts of, terrible things, divorce, etc., illnesses, cancer. And with compassion fatigue, you'll get potentially PTSD-like symptoms. So it's something really, really serious. It's just crazy we are not implementing education early on, and we really need to get cracking on this, because obviously with the pandemic things are a lot harder for us.
I think that's really interesting because what you just said, because to me burnout is when you're doing what you have to do, like go to work, but you don't feel like you're actually there. And I think that sometimes, especially in the NHS, if you're working 7 days in a row, you're working 80 hours, by the end hour you're not working on the same level as you were at the beginning. And I think that is really important, not only for ourselves but also for patient care, that you want to be the best version of yourself when you show up for work. Like, you want to be that person that's going to do everything, go the extra mile. Like, all of us go into it to want to be the best version of you that you can be. You go into it to want to be the best doctor or the best dentist or the best physio, and you want to have that time to think about what you could do better, rather than just to be, as you say, just to physically be there.
So I just wanted to add a few things. I think it's really important that we talk about the signs and symptoms of burnout, so we can start kind of recognizing this in ourselves and increase our self-awareness. Because in my clinical experience of burnout, personally, I didn't know, and I've done lots of interviews with dental professionals around burnout. A lot of us don't know that we've experienced burnout until crisis point, and by then it's very, very late. So it is really kind of crucial that we kind of explore what those signs and symptoms are, and then really, actually, I think personally, and I'm going to probably say this from a positive psychology perspective, is to think of, what is the flip of that? What are we talking about? We want engaged healthcare professionals, and how do we kind of foster that? So that's really talking about organizational change. It's really talking about even kind of individual changes we can make, but we need to talk about that more, and perhaps the conversation needs to shift from, we already know what the problem is with burnout, but like, how do we create and foster engaged healthcare professionals that have this passion for their job, their patients, and this kind of healthy self-esteem, are compassionate, empathetic? How do we do that? How do we nurture those positive emotions? I think with often the mental health conversation, it's so much shifted towards those negative well-being markers, but we can look at the opposite. We could have a conversation about, well, how do we do the flip? How do we encourage more positive emotions at work? And all of that is so important, because we know from the science, we know that positive emotions really buffer us against stresses, and we need to kind of shine a light on what is possible when we look at organizations and individuals, because there are things that can be done, and these are potentially quite small changes that can make a meaningful difference in prevention.
I think that organisational change is a big thing, because I think that quite often in the NHS, maybe this is just my personal opinion, but a lot of it is put onto you, and it's like, you should do all of these things to make yourself more resilient. This is how you can change. This is what you can do. Have a bath, exercise, eat well. And you think that's all well and good, but if I'm working 7 days in a row, 5 12-hour shifts, like, when am I supposed to exercise? When I get home at 9:45 at night? Or like, when are you supposed to eat well? And it's difficult for things to be put on that, and that's great. Like, there is definitely organizational change that's happening, so they're kind of having like talk about it hours at work or things like that, which is great. But at the same time, whilst you're at work, you're very busy. You don't necessarily have an hour that you can talk about it. And there is organisational change, I think, that needs to become aware of what they can do to help with people, rather than necessarily being like, you should be more resilient, all of these things. Like, it's on you to prevent your burnout. We all go through quite a lot of things when you're at work, and it's just natural that that's going to be difficult to deal with. And I think that there's different things that organizations could build in, as you say, kind of small things. Even if you just did like a minute of mindfulness after the ward round in the morning, you know, like if you just kind of built like steady things in, I think that would really help.
Yeah, I think 100%, you know, we need to see organizational changes. This is such a complex, you know, issue. It isn't down on the individual to make these changes, and that's how it works. But having said that, I have seen change. I've been working on this specifically within dentistry for the last, you know, 2 to 3 years, and there's such a great appetite for well-being. And so organizations are kind of taking note. I mean, right now it's, you know, the one-off webinar or, you know, several workshops, but we need a program. We need this integrated in undergraduate curriculum. So there are changes that need to be made. I feel like it's something that we kind of need to push for with organizations. As I was saying, I really feel like education is one route that we could like make a really big difference. We know that interventions work when it comes to well-being, and particularly when I look at medical professionals, because I've done lots of research in that area, and there's loads and loads of research to support that this works. And it's just about obviously the changes in curriculums, and you know, we will get there. I'm seeing changes, so it's going to happen, but it's certainly a lot slower than what we would like, and it's very frustrating. In dentistry, what I'd love to see is, you know, a compulsory emphasis on mental health, well-being, education. Like every year we have to do medical emergencies training. And of course that's important. I love it. It's great. But why isn't clinician well-being, you know, up there? And it needs to be. So, I mean, you know, last year there was like 6 deaths in the UK of dentists. There was 1 dental student as well. And so this is really kind of pressing. Yeah, the suicide rate is so high, so we just really need to do something. It can't just be things at crisis point, you know, a you know, helpline or counselling. That's just not enough.
Yeah, it's really interesting. I totally agree with both of you around finding that balance between the structure and the individual, you know, and because I think the pendulum swung in the past to be very individualistic based, and then we then stigmatize, blame, and shame people for not achieving whatever they need to achieve, which is not very helpful or productive at all. And if we swing the other way, all the way to, you know, completely making it structural, then we feel that we're disempowered and we don't have choice. So there's a sweet spot in between those two, the individual and the structure working together, and understanding that they both are important. You know, Marika was talking about the signs and symptoms of burnout and compassion fatigue. And something around self-awareness comes up for me. And it's interesting, we talk about the curriculum changing and improving and things like that. And isn't it interesting how we live in a society where we spend so many years developing our critical, rational thinking and so little time developing our emotional intelligence?
We've touched on the balance of individual and self in terms of self-care, but how do you actually be there for others? How do you actually listen to people? Because sometimes a lot of kind of what's needed is just a bit more compassion, a bit more kind of listening, a bit more space, safe space for you to express yourself, to express your emotions. And that's just a big thing that they just don't teach us. They don't allow that to be part of our experience at medical school. What do you all think about that?
There are interventions in other medical schools, so this is happening, and this is the future of you know, medical professionals, healthcare. This will be the future. So when I talk about wellbeing education, I'm talking about this. We need psychological tools to create these, you know, boundaries and look after ourselves. I think that's actually down on individuals to create these programs to help, healthcare professionals with these tools to tool up. But certainly there are interventions, whether it be CBT that like resonates with you, or mindfulness programs, or self-compassion training. These are really crucial kind of evidence-based things that make a meaningful impact. So you're right, it is a combination of individual care, but it also needs organizations to acknowledge it. It is changing. I've seen it in the research. I'm certainly kind of pushing for it in my kind of community, and then I want to kind of explore it in healthcare. But it's happening, and it is the future, because we do need training in emotional literacy. But you're right, it can be such a minefield working out like what that could look like. And then I guess the other comment I wanted to make was about self-care. Self-care is very much focused on the individual, and it's really important kind of practices we do to nourish ourselves. But the issue with self-care is that it's done, it's not done when you're with a patient. You can't go for a jog or have a bath when you're being triggered by a patient, right? So we need these kind of tools that we can use in the moment when we're triggered, when we're feeling a sense of like shame, where we're feeling really, really anxious, we're not good enough, we notice perfectionism kind of like taking on, or a very harsh inner critic. All of these things, we need practices that we can do in the moment, and that's where self-care is just not that helpful there. So I feel like we need a combination. The issue is, whilst you're with patients, what do you do? Whilst you're dealing with colleagues, whilst you're in these very tough emotional experiences, what do we do? How do we down-regulate our emotions at that time? And again, these are things we can practice, just like we practice communication skills or clinical skills. We can practice emotional resilience skills.
You were talking about how you have certain things that self-care is very important to do, obviously outside of work, which I think is very true. I think you can do lots of things. I think I found the things that have helped me is kind of writing down all of the good things that have happened that day, every night. And I think it's important to kind of give yourself some time to kind of wind down before you go to bed. I think that all the basic things like a good sleep routine helps, like eating the right foods. But you were talking about how you can sometimes do things specifically in the moment, and you mentioned kind of mindfulness and other things. I was wondering about whether any of the research that you'd found had come up with particular things that you were kind of alluding to.
Yeah, there's a lot of really interesting research around interventions, especially in the world of healthcare professionals and medics specifically. Unfortunately, not much with dentists currently, but in the world of medical professionals specifically, we know that mindfulness-based interventions really work with giving us the tools that we can use in the moment with patients. So for example, when I'm at work, I will infuse mindfulness throughout my day. So I'm not practicing it, and doing meditations just at home. This is stuff I'm doing with patients. So when I'm curing composite, or when I'm loading the computer, or I'm having my lunch, it's practicing mindfulness through taking 3 deep breaths, for example, or kind of in between each patient, if it's a particularly kind of stressful day, or just because we want to. Me and my nurse will get some aromatherapy and take 3 deep breaths of that, and just anchor to the present. We know from the research that infusing mindfulness throughout the day with our patients is really, really kind of beneficial. The other thing I was going to mention, which is really important, is self-compassion training. There was a really interesting study a few years ago about compassion, cultivating compassion training in medical students, and they found that this intervention, it was 7 weeks, really helped to boost not only self-compassion but resilience, happiness, quality of life. What I mean by practices in the moment is when you're with a patient and you catch those negative thoughts, and it might be, I'm not good enough, it could be like a really critical thought. It's using this strategy of, first of all, mindfulness, where you really kind of don't get lost in that story and give some space between the thought you're having and your emotions, and to not kind of fuse with them. That's what mindfulness kind of lets us do. It's not really about relaxation, although that's often a byproduct. It's more about accepting our emotions and thoughts and not believing that they're 100% accurate. So just kind of making room for them. Next, it's recognizing that we're all connected by suffering, and we all go through this experience of these negative thoughts. We're not alone in that. And then thirdly, it's offering ourselves words of self-kindness, like words that you would offer to your best friend, and it could be as simple as, look, I've got your back. I know you're in pain right now, but I'm going to be here for you. And it's just not true, this thought. It could even be touch, and that works really well. So we know that touch really triggers, in terms of our physiology, all these kind of different hormones that make us feel like really, really good. Just like our mother would hug us, etc. We can do that with ourselves in the moment when a patient's with us. And what I do is I might like squeeze my hand or my arm. I notice I do that when I'm anxious as well. It just really calms me down. And these are really simple things that we can do. And partly it's because I say partly, it's very common because our brain is actually evolved to look for threat. And so our brain is prone to getting tripped up by cognitive distortions or thinking traps. And for me, it's catastrophizing. And for everyone, it's a bit different. But it is certainly about kind of recognizing, look, what are my common thinking traps? What can I do so I'm not staying in that experience for too long? These are all kind of tools I can use so that when I get home, I'm not as drained, I'm not as impacted as I could be. And I think that's where these interventions really shine.
I think that's really interesting, because I think that we, as much as I was saying that organisations kind of need to do things earlier, like a lot of them have been doing things kind of in the hospitals, but it is very much kind of like take an hour out of your day, or they want to teach you about well-being, but then they very much do the things where it's like sacrifice your time to do 15 minutes of mindfulness every day. And you think, well, that's great, but like, I'm already so busy. How am I supposed to sacrifice any more of my time? Like, what do you want me to give up in order to kind of look after myself? Like, it feels like sometimes you feel like in order to look after yourself, you have to stop doing other things that you kind of enjoy doing, because you just don't have the time to do them all. But I think that the education is definitely really important, because as you say, those little things, kind of like 3 deep breaths in a certain situation. Like I remember I went to an arrest, and arrests are just really traumatic. And then afterwards, kind of, I was maybe the first doctor there, so it was quite, it's quite intimidating, quite scary. And then afterwards, I started crying. And then I just took myself off to the toilet. I did a 3-minute headspace meditation thing, and then I came out and I was like, right, I'm ready to face the day. But I think it's really important to kind of teach that you can do the three kind of short breaths and things that you can incorporate into your kind of daily life, so that you don't have to, I think it's really good that you don't have to sacrifice anything else in order, it can just add to your life rather than having to have anything else taken away. I think that's really good.
It's so really interesting. So we talk about safety and we talk about permission to show my vulnerability. Wow, I have to go to the toilet to actually cry and compose myself, because I can't, it's interesting. What can I show in society and what can't I show in society? It's really interesting. And crying is bad or crying is wrong. I don't know where, because of course I experience all these things and I really and I feel it because I've done them myself. And I go like, gosh, what is it that can I give myself the permission to even show it? Never mind showing, can I even give myself permission to express it? And then, so that really, really hits me. And there's something around safety comes up. And we see it in pain science quite a lot, that our threat response or our danger assessment of the world is highly connected to our safety, and safety is really connected to our well-being. And I often think about this whole failure, mistakes, and shaming, and how that is related to us feeling unsafe. And I think about, gosh, maybe we need to demedicalize and rehumanize, because all of these things have a human component to them. And that really starts connecting more for me, the sense of connecting our humanity.
I think it's really important points that you've raised. I feel working with patients, so it means that we do have to be professional, and that's where it's difficult in that, when we are triggered, we need to still maintain a certain kind of decorum. And that's where, being that fully authentic self, it doesn't kind of work, does it? You can only do that for a brief period of time, and then you do need to deal with those emotions. You can shove it down for a period, but at some point they're going to come about. And I think that's where, using these tools can be really beneficial. And as you were mentioning, Anif, as well, about having that peer group system, even like kind of within your work environment, having someone safe that you can talk to and cry and really show yourself. I mean, for me, that's my nurse. That it is important to have those empathetic spaces, because community makes a big difference, and we know that positive organizations make a big difference on our psychological well-being and resilience, so that definitely plays into it. But yeah, it is tough putting on these masks, and being put in these situations that are very emotionally charged.
Just love what you said there about the masks we put on, and what this persona of this ideal archetypal professional that I have to become, and where did I learn that? It's so interesting because there's a tension there. Like, at the one hand, we're saying, oh, we need to be self-aware, but don't show your emotions to the world. But we're telling our patients they need to also be self-aware and like look after themselves. Can you see there's a tension? So I am self-aware on my own. We're telling the patient to be self-aware, but we can't model self-awareness for them, and we can't be emotional because the constraints of professionality, how we've defined it, mean that it's slightly empathetic, we're supposed to be, but not emotional.
I think maybe because I was just thinking about what you were kind of saying there about how we're trained not to show our emotional side necessarily to the patients, but I think maybe because, and I was thinking about why it's happened, and I think that it's because in that situation, so when there was this arrest and I cried, I cried out in the open, but I did the meditation in the bathroom. But I think that it's more traumatic for them, so you have to kind of keep your side in, because it's not, although it's perfectly valid for me to feel those emotions at that point in time, my job is to be there for their emotions rather than to show mine, I guess. You're being there for them as a professional capacity, so when you show your emotions to other people, it almost in a way, it makes them feel like they have to kind of take on your emotions as well as their own, maybe.
I think about my profession, and I think like, if I were to ask you now, what is the archetypal physio and what is a physio, you'd have an image come in your mind. You know what I mean? And that's really interesting, because what if you don't fit that image? You know what I mean? Then where does that leave you as a professional? And where did we get that archetypal image from? You know what I mean? And how that feeds into how that comes across, you know, to clients and things like that. So I don't have answers. I'm just, you really both are stimulating thoughts in me about, this is a complex, challenging field, and we're all trying to navigate it and figure it out. And we have tons of information that we all know we can do X, Y, and Z to manage our physical health and our mental health. We've had tons of information about physical health, and half of us don't even do it. The packet says don't smoke, and still people smoke. You know what I mean? So we have tons of information, and so what needs to change for the behavior to change, etc., etc.?
Yeah, I think we do need more help though in how to create positive behavior change, and I think that's what's missing currently. You know, it's not enough for me to tell my patients that, you know, you need to stop smoking and you need to use interdental brushes and floss to prevent gum disease. It's really getting into how do you help, you know, ourselves when we're talking about clinician well-being. How do we create behavior change that's sustainable? How do we even go about that process? And I think that's where health psychology could be really beneficial. That knowledge is really kind of crucial, because once you know how to use it in your life, and again, as with all of these things, it's very individual. You kind of take what you need to and you experiment and work out what works best for you. But once you kind of figure that out, and it's not, I have to sacrifice my time for 15 minutes of mindfulness, it really, really benefits my life, and this is the kind of life that I want to live. But it isn't as simple as giving a bunch of information or theory, etc., or even teaching people tools. It is about helping people in that process of creating that change. And that's where, you know, mentorship can be really beneficial. Groups, peer support groups, etc. Coaches can be really helpful.
Definitely some very insightful and interesting points being raised. I definitely agree with the sentiment of kind of undergraduate training. It needs to start as early as possible. I mean, a lot of these things need to start in primary school. You know, we need to know what emotions are, how to label them, because if we don't, we can't label them, and then we find any other means, like Sudhir mentioned, of numbing the feelings because we can't deal with them. And that isn't just healthcare professionals, that's everyone, and that's a lot of our patients that we come across as well. They don't know how to deal with these things, and we don't know how to deal with these things, and everyone is just lost, but we just move on day after day after day. So I think a lot of kind of what we've covered already has shed some light on some of the aspects of kind of what we need to change or implement in our professional work and practice. I just wanted to touch on kind of the final point about how do we set boundaries, both professional and personal, with colleagues and patients to ensure our well-being?
I would really bring the research around self-compassion training into this conversation. To set boundaries, self-compassion can be really kind of beneficial. And that's kind of reminding ourselves that, look, we can't get rid of a patient suffering entirely. It's just not, you know, possible as a human being. Definitely we're going to try and we're going to do everything we can, but there's a limit. So kind of being aware of our kind of role in this conversation, because often, certainly in the world of dentistry, I'm sure it's the same in like medical and physio, patient will come and they will really, the conversation will be angled towards, look, I've got this problem, you're going to fix me. And that just isn't the way it goes. It's not like that. And so to have that kind of awareness off the bat that actually I'm going to do what I can is a part of self-compassion, and it's about setting a boundary. And then, as I was saying, it's like in the moment, what can you do to offer yourself kindness when you are feeling triggered or you need it, or when things go horribly wrong, when there's failures. You need those words of self-kindness and soothing yourself. And that's kind of really kind of crucial when it comes to also boundaries as well. It's crucial when it comes to things like compassion fatigue, and just acknowledging that, look, I'm going to try everything I can for my patient, but I just can't fix it all.
I find really interesting what you said about the curriculum is not up to date. It's not only not up to date, it's also not evidence-based. Ironic, when medicine is the very thing hammering on about evidence-based, we just have the whole field of psychology and behavioral science giving us more and more and more science, but somehow medicine thinks that science is not applicable because it's a soft science, maybe not a hard science, So the privilege in academia, and the and interesting. If the mindset doesn't change from those in positions of power and privilege who have the ability to change curriculum, change things, then they'll just be veneer things. We'll do optical tokenism, we'll put a webinar there, we'll create this. And then it's a nice optical and everyone goes, oh no, we look after our team. We have this person on site and that person on site. But really it's just veneer because the mindset really hasn't shifted. And it's interesting, you talk about boundaries. For me, saying no. And we talk about in healthcare we must go in CPD, but all our CPD is very hard skills orientated, not soft skills. How do I learn to say no? I have to go on an assertiveness training course. I have to go on a self-confidence course. I need to go on emotions. Do you see that being advertised in the back of the journal? No. So we have to, how do we learn to say no? And we have to go. So those are the courses we need to go. And that's for me is saying boundaries is, actually you find more freedom. You can measure it by the things you're willing to walk away from, and there's something in for me about boundaries and saying no. But in order to do that, we need to know our values. We need to know where we are. So then we know what we're saying no to.
Yeah, I think that's really important because saying no is something that I've kind of always struggled with. And it's because I want to do everything, because by saying yes to one thing, you're saying no to something else. And I think that you have to constantly think about if you feel like you should say yes, you have to realize that by saying yes to a project, you're saying no to dinner with your friends, or like you have to work out that just saying, you have to realize that even by saying yes, you are saying no, but to something else, and you have to work out what you're saying no to. And I think that Sadir was right about working out what your values are, and you have to work out whether that particular thing that you're being asked to do is high up on your values and whether it's worth the other things that you're going to have to say no to.
Yeah, I definitely agree. Thank you all for bringing up all these very insightful and really good points about all these things, because I think that's the key thing. This is how we start discussing these things, and we start becoming more aware of what's happening in practice, how we are being impacted as an individual, having our own triggers, having our own personal experiences and past experiences that we are more sensitive to than maybe our colleagues, but also recognizing when to kind of reach out for help, when to talk about things, not to keep it in, to recognize that we are all suffering in one way or another, and we're connected by that suffering, as Mahrukh mentioned. It's been really good. We've covered a lot of ground. We've talked from burnout, compassion fatigue, to kind of covering what self-care is, what it looks like, and whether the system actually cares about us or not. And we've mentioned some of the things of what a caring culture looks like, having those safe spaces, having colleagues to talk to, and explore feelings, and being able to have those feelings, and having that permission to express those feelings as well. But yeah, like being stuck within that profession and individual, and finding that balance between the two is definitely difficult. And by no means are we claiming that these are all the answers, but it's been so great having had this conversation with all of you. I want to thank you for all your time and for joining us this evening. And I want to say special thanks to the HLA Live team for giving us this platform to have this conversation, and to the HLA itself for continuing to promote leadership in healthcare and really paving the path for a better and brighter future for healthcare and healthcare professionals.